older people to have.
Did we lose her?
I think
We
so.
might have lost Dr. Taimba.
Well, I could jump in and say, you know, working in the community and especially with young folks, you know, the levels of depression that we've seen over the year and a half have greatly increased because of that. They are being isolated, sitting in the house, and they're just so eager to get out and get around their peers, get outside and do some of those things that are natural to them, and that's something that they need. They need that social environment. And we have done a lot of work on trying to help our youth, you know, figure out ways that they can get connected again. A lot of that's been non-traditional supports. We've been working with schools, athletics. CRC has been a great resource here in the city. And, you know, we're still battling with that today. Young people who are struggling in school because they could not switch to the remote setting. And that didn't just translate to them, but also to their parents. And like Doctor was saying, I think she's back here. But like Doctor was saying,
It jumped off. I'm so sorry.
Oh,
I
you're fine.
really apologize. But that isolation does create a problem for us in our neighborhoods and in our communities.
Okay. And then I know by being in the public school system, we're seeing it more and more. An interesting thing is, you know, with kids being off almost a year and a half, now it's trying to reacclimate them to having relationships with one another and what are appropriate relationships and things of that nature. And that's one of the things we've been in school, I think the last 2 or 3 weeks, that we've come to realize that, you know, we have to totally reteach and rethink what we're doing as far as our students, just because of what they've lost as far as that social interaction. So I definitely agree with that. Dr. Taimba, I got a question for you. We know that COVID-19 pandemic has affected the rate of addiction. What do you view as the cause for the associated increase in overdose rates, and how does that relate to racism? It almost seems like it's the same, but if it's...
Well, you know, it's very related to that, because people will begin to use by themselves, which increased the overdose rate. It increased the fatal overdose rate, because when you use them by yourself, you don't have anyone to help save you if you do overdose. And it also created a different drug market, because people wasn't having access to the same kinds of drugs. And so they start lacing drugs, and they were lacing drugs primarily with fentanyl. And so you saw marijuana being laced with fentanyl that you didn't see before, or as much, right? And you did see crack being laced and cocaine being laced, but that increased. And so the majority of our overdoses in the Black community is not heroin, it is other drugs being laced with fentanyl, and that increased. But people start using by themselves or use it in smaller groups. And what Black people don't understand is that they're protected by the Good Samaritan law like everybody else is protected by the Good Samaritan law. And so if you report an overdose, if you call 911, if you try to save someone, you're protected also by the Good Samaritan law. But that has not been known in our community, right? And so we're more likely to run the other way if someone is overdosing, as opposed to call 911. And so
what did you say? You said the Good Samaritan law?
Yes.
Okay.
That's what happens. So, you know, if someone overdoses in the larger community and they call 911 and the, you know, the police comes, no one's going to jail. Well, Black folks don't know that, right? And so they were using the old remedies to so-called save their neighbor, as opposed to calling 911. Okay, so no one's going to jail. And so that's the part of the distrust that Black folks have with the larger society, right?
Yes,
okay, and so we have to get that word out, you know, and I've been trying to pass out all the Narcan that I can pass out in our neighborhoods, right? Okay, please save your neighbor, right? And so, right, so with COVID, it was fewer people around to help one another, right? And then they were worse drugs, you know, the chemists were fewer,
Right.
right?
Yeah.
Right. The street chemists was fewer, right? And so the overdose rate increased. And you can still see that the overdose in the Black community is 7 times the rate in the white community now that COVID is here. And
Is that 7%? Is that the fatality piece that you're talking about?
Yes, I am. Yes.
Okay.
Yes.
Thank you.
Mm-hmm.
Dr. Pickett, what racial disparities have you witnessed working with mental health agencies and also within the school systems?
I've not got the doctor before my name yet, but just speak it into being. Thank you.
Yes, indeed.
Speak it into being. So some disparities that I've noticed working, I'll start with the schools, is that for our youth of color, they are being suspended at a higher rate. They are being forgot about, especially in the past year and a half with this pandemic going to remote learning. They've been placed on different programs for credit recovery and then never thought about again, and hopes that either that child will just drop out or leave the school district. We've done some great work in reconnecting families with the school system. And when we have these meetings, we push for them to be in person. Disrespect of these families because they're lower income or even people of color. And when they're doing these Zoom meetings, nobody's video is on. And you can tell they're either in the car driving. They're not giving them the time, the sincere time to look through, what their child needs to succeed in that school system. And also, even before the pandemic, we saw a lot of getting the resource officer involved with minor situations with kids of color. If he is in the halls or she is in the halls or speaking back, it's quick to go get law enforcement involved instead of let's take this to the principal's office, let's sit down and talk about this. And we already know how our community and our young people especially feel about law enforcement. So that just agitates it even more. With mental health agencies, it's a lack of patience, in my opinion, in dealing with some of these families that come in and they're expressing their issues. And it's often talked about, well, that's just, their culture. This is how they are, instead of really listening to what's going on. And then I'll even add, sometimes even overdiagnosing and saying that this person has, severe mental problems here and there and this and this and that, when it might just be they're going through a crisis or it's just in their life at that moment, things are kind of hectic. So there's a lot of things that we need to work on in the mental health field and in our schools to better help our children and their families.
And I know in the school system, a lot of it has to do with, and it's everywhere, but educating the teachers, educating the administrators, educating all those support staff on not only the ethnic makeup of your school. So you have to talk about culture, but you have to kind of approach things in a different way. The example you gave of the resource officer is one that really hits home with me, because a lot of times, that's the first thing they do. Well, you have a teacher, you have an administrator, contact the administrator. The child is being somewhat disrespectful. That does not mean that he has to have interaction with the police officer. So that's definitely something I know in our district we talk about, and in other districts, they're starting to have those conversations. So thank you. Dr. Lewis, I know that you do things, you have a nonprofit and it's outside of the United States. Can you talk about some of the work that you're doing there and what you're seeing outside of the United States?
Yeah, thank you, Eugene. I run a nonprofit Village Life Outreach Project that's been working in Tanzania, East Africa for about 17 years, working with some very low resource communities there, people living on less than $1 a day. And in those harsh settings, as you might imagine, mental health illness can be quite significant. One of the ways that people are able to work towards mental health and wellness is just the concept that they have, that many folks in the villages in which we work have related to community. Literally, it's life and death, and they depend on each other. And that community strength helps uplift the individual members. And I liken it to a little bit of what happened in our country after 9/11 20 years ago. Terrible tragedy, But in my 46 years on the earth, it was also one of the times when I felt personally like our community as a country was the most connected and banded together in the tightest ways, and everybody started looking out for everybody, and there was just an increased level of decency and civility. And unfortunately, if you compare that tragedy to the tragedy of the COVID-19 pandemic, we've seen almost the exact opposite in this country. You've seen, the pandemic caused splintering and a loss of civility, and people spewing rhetoric, from the top leadership of our country all the way down. And I feel like, maybe it's just me, but I feel like we're more divided now than ever. And I think that takes its toll on mental health in our community. And, I think there's a lesson to learn from the folks that I work with in Tanzania. My organization isn't one of just, we're providing service to these people in Africa. It's, we're working with them in partnership and learning from them lessons of community, humanity, civility, taking care of our neighbors and the importance of that. And we try to bring that back home to our own community. And I think never has it been more important to focus on taking a page out of that sort of book, where we're really focused on each other and not just ourselves.
And as you bring it back to our own community, how would you look at kind of taking advantage of mental health equity, or trying to get mental health equity into our community?
Well, I think we're at a unique inflection point in our country and in our community, whereby racism and health equities are two of the top items of discourse that we are having in this country right now. Everybody is talking about health equity. Everybody is talking about racism, inclusion, diversity. Never, in my opinion, never has the time been more right for us to band together as a community to not just have these discussions, but to have them lead to impact. There are a lot of people, including my colleagues on this panel, and I imagine that all of the participants in this call that are working with their various agencies, with their various networks, with their various avenues. If we can continue to harness the collective power of everybody that's working on this, I think we're going to be uniquely suited to make some advances in health equity in our community as it relates not just to mental health, but health overall. I'm president of the Doctors Foundation, which is an organization with a very large endowment geared towards the diversity of the healthcare workforce. So at the same time I'm having that discussion, I'm also sitting in meetings of the Cincinnati Medical Association, which is the group that represents underrepresented minority, traditionally African-American physicians. At the same time, I'm having discussions with the chief diversity officers and some CEOs of some of the health systems that are very interested in leveraging the resources of the community to increase the number of minority providers and African-American providers, not just for mental health, but healthcare overall in our community. So again, I think we're at a unique pivotal point with everything happening in our country, that if we band together as a community and take advantage of it, I think we can impact a lot of people's lives.
Okay, thank you. Anybody else want to add? Thank you. Dr. Taimba, when it comes to addressing the stigma in the Black community, what have you found not effective?
Not blaming the victim. So, and we do that so well. We blame the victim. So we have to acknowledge post-traumatic slave disorder. We have to acknowledge that. We have to acknowledge the fact that we are suffering as a nation because we don't take ownership of our wrongs, right? So we have to take ownership of the fact that we have to undo some things. That systematic racism does exist, right? And that it is profound and it's systematic. This is in every fiber, every institution that we have in America, right? And so, people behave the way that they behave out of survival sometimes. And so, when we do a great job of victimizing people by saying, oh my gosh, look at those people, they're behaving this way. Earlier, someone talked about the young people and how they speak at school, those children are having conversation with adults, and this seen as disrespectful. But if you go to some other schools, it's seen as dialogue. They're not disrespectful. They are being assertive. They are just having conversation, and it's welcomed at some other schools, right? And so we have to really have a level playing field for all people. And so this double standard that we have for Black people in America does not work. And so this whole the stigma around Black folks is supposed to be stronger and be able to withstand more pressure, and therefore don't need to seek out help for their mental health. That doesn't work. That doesn't work. So I think that we have to really go back and, and we have to change some things about the messaging in general. So to answer your question, ignoring the truth does not work.
Thank you. Before I open up for questions, I know we talked about equity and some other things in community. I didn't know if anybody wanted to add anything else to the equity conversation, or just the reimagining of what a conversation should be with individuals concerning mental health, COVID, and how that relates to one another. Nope. On once, on twice.
Say it again.
Okay, well, I'm trying to, does anybody have anything to add on the conversation around, we talked about this being a pivotal point, and how do we reimagine, we have to make people reimagine what's going on and change the conversation. And what are some ways that, some other ways that we possibly can start doing that? I know we have individuals on all types of, belong to all types of organizations, and how can they start to broach those conversations with their peers to have them kind of reimagine what they're seeing and what they're thinking? Was the question. Once, twice.
And that was for the people on the call.
That was for you all, because I'm gonna open it up to them next.
I think Chris shared some things that I was quite impressed with, is how he's relating to all those bodies that he has influence over, right? And so and that's what we have to do. We have to use our circle of influence. He talked about that in a very gentle kind of way. I really appreciated it, Chris. I hope it's okay to call you Chris. Right, but he's talked about those circles of influences that he have, and we have to do that. We have to use our circle of influence to change the way that we function on a daily basis.
And I would piggyback with Dr. Tyehimba that the importance of minimizing or decreasing or erasing the stigma around mental health is huge. That example that she gave of the kids talking in the class was huge. And I think we all have the power to be a voice for the voiceless.
Leah has her hand up, though. I think it's pronounced Leah.
Yep. So what we're going to do, first of all, thank you, panel, for your time and contribution. We're going to open up this for questions. So if you have questions, you can unmute yourself, or you can put it in the chat, and we will answer those questions.
There is a question already from Leah, and I will read it out. I met a woman in Cincinnati who was microdosing Narcan to prevent a relapse on crack. What is the difference between Narcan and fentanyl?
Okay, so Narcan is the medicine to take you out of an overdose. Fentanyl is the drug that's causing you to overdose. So fentanyl is really used as a sedative, right? Fentanyl is, first of all, is synthetic, right? It's a synthetic opioid. And I guess I probably should let Chris answer this question, but it's a synthetic opioid. It's a drug to get you, it's not used properly. Fentanyl is supposed to be used under medical care in a hospital, right? So it's on the street, it's illegal, illicit drug. Narcan is not that. That's what not Narcan. It is used in the hospital. It's been used in the hospital for years, by the way, right? Right, to help people. But it's not in the same ball game at all, right? It has nothing, hot dot, it has nothing to do. Fentanyl and Narcan has no relationship with one another, except Narcan is trying to save your life. Fentanyl is trying to take your life. Okay, it's yeah. I hope I was trying to make it as plain as possible.
I have a question. I am working with a family who has a 7-week-old baby. And last week, the baby was transported to the hospital and given Narcan. They said that the baby had ingested drugs. So now there is investigation going on to figure out how the baby got drugs, 7 weeks old. So I'm just wondering how the drugs are, how you can actually get drugs into systems of like babies or children, because they're not taking pills, and I don't think they'd be smoking a pipe.
Well, you don't have to. If fentanyl is in the air, it's like you could just touch something that fentanyl touch, and they could get in your system. Fentanyl is deadly.
Yeah, and that's what I thought about.
Yeah,
but
so
I just wanted to.
Deadly. So if the mama had fentanyl on her hand and touched that baby, yeah.
But I think the mom was. This is what I think. I think the mom was doing fentanyl and possibly meth and breastfeeding. So I think the baby might have got an overdose of drugs from breastfeeding. Do you think that's possible?
I don't know. I haven't seen any evidence of that, though. Chris might be able to answer that question, but I haven't seen any evidence of that.
Yeah, without knowing the details of the situation, just take all my comments with knowing that I don't have the full knowledge. But yes, I think it's possible for breastfeeding exposure. I think it also could have been a mistake where someone in the household had the drugs and somehow inadvertently, maybe it got in the milk somehow, someone made a mistake. Maybe it was on purpose. I don't know the details, but I think it underscores the importance of drug addiction, drug abuse, and other activity related to drugs. It typically doesn't just impact that one person, it can impact the whole family.
Thank you so much.
I have a question.
Go ahead, Danielle.
I wondered where especially people of color could find accessible professional mental health therapy. Just sort of thinking that, everybody should be prioritizing their mental health in a world where we're all sort of facing trauma in various ways. And so I was just wondering how to find quality mental health care and feeling safe to do so, whether the person is, whether the therapist is a person of color or if they're another race, just being able to talk about all of the things, especially, generational trauma and that sort of thing.
Well, I can speak about, go ahead, doctor.
Well, I was going to jump in, but I didn't know if you wanted to speak first, but.
I was going to say at the Lighthouse, we are able to help out with finding a therapist, and I encourage people to be very direct when you're reaching out and ask for a therapist of color, and because that's going to help your process. So Lighthouse Youth Service, I was going to say Talbot House has some resources as well. And again, when you call these agencies to get a hold of them, I would just say, be honest about what you're looking for, because it is, to benefit your mental health, it is to help you. So be very direct in asking that question. I would like a Black therapist or a Black woman therapist or a Black male therapist.
And there are the Black psychologists directory. So yes, don't ever be ashamed to ask for a Black therapist, whether you go into a public organization like Tower House or Lighthouse, or you're going to use the Black physicians directory.
And as a primary care physician, I would also add that I would encourage everyone to have a primary care physician, and to make sure that that primary care physician also serves as a go-to place for you to get the help that you need. I'm a firm believer in the link between mental health and physical health. And so utilizing that resource, I think would be important. There's a few listings in the chat from Q: therapy for blackgirls.com, therapyforblackmen.org, for those of you who may not be able to see the chat. The Cincinnati Medical Association is also a great resource.
Thank you, Dr. Lewis, for reading that out. There is another question from Leah, who asked whether there are any long-term effects of Narcan.
No, there is not. There is not. Narcan is a particularly safe anti-overdose medication. There's no harm. Even if you find someone passed out on the street and you don't know for sure if they have had an overdose, and you give them a Narcan, you cannot hurt them. Narcan is extremely safe. I really advocate that you try and save a life, right? There's no long-term effects from Narcan. No.
Yeah, I would concur. There are some limited short-term side effects like headaches, joint muscle pain, nose irritation, upset stomach, things like that. But in terms of long-term, what you're really doing by giving someone Narcan is saving their lives.
And Tower House have Narcan that they can share with the rest of the world. And so of course, they would train you how to use it. If you have a group that you want trained for Narcan, Tower House will be more than happy to come and train your organization on how to use Narcan and supply you with Narcan. The overdose rate in Hamilton County is just tremendous. Every one of us, just like we have a first aid kit in our house, should have Narcan in our house.
I see a hand up. It says iPhone. Is that a question or? If so, you can unmute yourself and ask the question. Do we have any more questions from our audience?
No, there are no more questions in the chat box. The person on the iPhone, I will ask you to unmute if you want to ask your question.
They may not be aware that they have their hand.
Yeah.
Right, probably.
Can I ask another question?
Yes.
Are you aware of faith-based therapists?
Yes, Danielle. Faith-based therapy is, there are a number of faith-based therapies that are provided by trained clinicians. And there are many ministers themselves who have received formal training to provide therapy. Yes.
Yeah, I think my home church, Crossroads, has on their website, I do believe they have a list of different types of individual and group mental health services. So I'd encourage you to check that one out as well.
Can I hop in?
Yes. Leah.
So I thank you guys, by the way, for just having this conversation and holding this space and answering my questions in the chat. Where I'm coming from is I'm a medical cannabis patient. And what I've seen is that there is a lack of access to the program, specifically for minorities. And so I'm trying to kind of figure out, in terms of harm reduction, can cannabis be an alternative tool for someone that is in recovery? So for me, it has been, and I'm just wondering, guys have any thoughts or input or just anything there?
I want to make sure I heard the question correctly. You're asking about the use of cannabis in terms of mental health recovery. Is that correct?
Yeah, in harm reduction specifically. And that's why I was asking the questions about the long-term effects of something like Narcan and things like that. And, you know, like for me, it's kind of where my head's at. What I'm thinking is, you know, once an individual who was having an overdose is given the Narcan, moving forward from there, what are then the steps? You know, are they then giving alternative medications? Are they given, what are they given moving forward? What are those next steps? And is there a way that cannabis could be utilized in that process instead?
Narcan is not an addictive drug. They wasn't using Narcan to get high. Narcan is real irrelevant to someone getting high. Narcan is not, so they wasn't using Narcan to, you're not addicted to Narcan.
Sure.
So that,
no, so my question, sorry, real quick, just to clarify, is more in like what's next. So if you've got a person who's in addiction, obviously that they're having an overdose, moving forward, what's going to keep them from relapsing? So like I mentioned earlier, I had met a woman who was microdosing the Narcan to prevent a relapse on the crack. And so if that woman could have access to something like cannabis, would that maybe help improve her quality of life?
From a physician's point of view, I think there is emerging evidence about some of the medicinal uses of cannabis. And I think we're going to continue to see more science and data behind that. I personally don't know about how useful it would be in the type of scenario you're describing. I would say that it seems to me that there's possibly a use for it, but I would highly recommend that any person considering using cannabis for the purposes of recovery do so under the guidance of a mental health provider.
I would concur with that. I was going to say, I would recommend that person go to treatment. That's what I would recommend, that they go to treatment.
Okay, we have one more question from Heather. Can mental health be treated by primary care physicians?
I can jump in. Absolutely. Particularly in Cincinnati, I think our medical community is very well equipped. And our primary care medical community is typically very well equipped and well trained in mental health. My personal practice, I generally treat a lot of depression, a lot of anxiety, a little bit of bipolar disorder. That's my comfort level. I don't typically get into being the primary treatment person for other psychiatric illnesses, for instance, schizophrenia and things like that. I would usually refer to a psychiatrist. But depression, anxiety, and some bipolar, yes, typically is within the purview of a primary care provider.
And I think one of the main things you said earlier was it was important for all of us to have a primary care.
Absolutely, not just any primary care provider, but ideally one that is sensitive to the connection between physical and mental health. Someone who believes in well-being as much as they believe in treating sickness. Promoting well-being is equally as important as treating disease, and someone who has a degree of cultural competence, I think, is critical. You know, I've developed a pretty good relationship as a primary care doctor in Cincinnati, not because I'm any smarter than your average doc, but mainly because I take the time to try to understand where my patients are coming from, speak the language that they speak, you know, and just try to walk in their shoes. And I think that makes all the difference.
Okay, thank you. We have time for one or two more questions. I don't see anything in the chat, and I'm gonna give us a couple seconds. I see a hand up by Sean. but you have to unmute yourself. Okay.
Good afternoon. My name's Sean. I am a new implant to Cincinnati. I was born and raised here, but I'm newly returned after my wife and I retired from the military. As far as medical providers, especially as it relates to mental health providers, the challenge that my wife and I have found has been twofold. We found difficulty finding providers that are either Black or Black adjacent, and they tend to lack cultural competencies as it relates to what military people experience, what veterans experience, what Black people experience, what LGBT people experience, or they don't accept TRICARE, so we don't even know if they have those competencies. Do you all have any resources outside of the VA for individuals such as myself?
Sean, I think that we could probably find something for you. I can't think of anything right offhand, but we do have a resource coordinator at Talbot House that could probably direct you somewhere. Yes, sir. I think that would be possible. Yes. So you could hit me up tomorrow, and I can help find you somebody.
So you said you're at Talbot House?
Yes.
And that's off of Victory Parkway, correct?
Yes, sir.
Okay.
Yeah. Yeah.
Thank you, Dr. Taima.
You're so welcome.
We have one more question, if we have the time, Eugene.
Yes, we do.
Some ways in which our teachers and educators can support our students who are in need of mental health services, but parents are reluctant to accept help.
I would say have teachers to reach out to the parents and do their due diligence in reaching out to the parents and try to schedule an evaluation for that child. If they don't already have a 504 plan or an IEP in place, figure out a way to support that child, get their, accommodate them on what they need, and really continue to reach out to the parents, because those who work, do social work, you're going to reach out to parents several times, phone, text, call, email, all that. You just have to be persistent in that. So I would encourage teachers and educators to do that in support of that child. And really try to get them involved in the IEP 504 process.
I think the thing to remember there, though, I'm sorry, the thing to remember there is that that parent may not have had a good experience with the school system as a person, right? And so they're reluctant to interact with the school. You have to be compassionate and kind and patient with that parent. Give them a contradictory experience where they can say, "Oh, I am willing to work with this person." You got to be kind of like trauma informed,
right?
Be kind.
And I think it has to do with, I know in education space, it has to do with building those positive relationships. And, when you work with parents and you have a positive relationships, and when you're speaking to them, every time you're coming at them, it's not something negative, but you're sharing some positive with the parent. That creates those positive relationships. So you can kind of have those conversations on be it mental illness, or especially if they're reluctant. I think you have to be able to, in an empathetic way, share data with that parent to let them know that, hey, we might have some issues going on that we may need to go a little further. And they always have to understand that you have the child's best interests in heart. So that's the bottom line. When they know that you care for their child and you have their best interests, they'll support you a little bit more in your decisions. And then that's the piece of that trust that we started at the beginning. When you talk about the distrust that's systemic, and that's also in the school system, you start to build those bonds and you start building trusting relationships. So I think it starts with that trust factor, and then have to continue to share with the parent that you care, truly care about their child and well-being.
And one of the things that Dr. Calloway, and I'm a parent advocate through NAMI, Ohio. And I work with the parents who have children who have been identified with mental health issues and have difficulty navigating the school systems. So right now, it used to be I only could get referrals from one person, but now I can get referrals, self-referral or whatever. I can do whatever I need to do with that. But the bottom line is, as you said, Dr. Taima, they parents usually don't have a good experience with school, period. So it's hard for them to talk to anybody about any issue because they've had a negative experience. So as an advocate, I help them to be able to navigate, get what they need, say what they need to say, have their voice heard. And for them also, another thing that parents don't like doing is putting things in writing. A lot of times they just need to put it in writing and give it to them. As an advocate, I do a lot of just listening. Yeah, but you really do have to work on that relationship, and it's really hard if you are doing some other things. So I just kind of, they let me retire, and I just kind of work systems. Okay.
Thank you. Well, for everybody, we are just about out of time. So I'd like to thank all of you in attendance today, but I especially like to thank our panelists for your time and attention to this vitally important conversation. We must not forget the importance of mental health as we address the public health crisis that is racism. As the nation's largest grassroots mental health organization, it is NAMI's acknowledged responsibility to serve all. You are not alone. I invite you to visit NAMISouthwest.org for Black, Indigenous, people of color, health, and mental resources, and to learn more about how you can join the conversation and join the conversation and advocate, I should say, for mental health for all. I'd like to thank everyone in attendance again. We appreciate your input and you spending time with us today.